Hey guys, welcome back to Pregnancy Flex. It's all about the fourth part of the pregnancy video. I'm happy that three part of the video you have witnessed it, and same way this is the last part of the video. It's all about the pregnancy exercise. What all you have to do as a partner, you have to support, and what are the things you need to do after getting a baby, and all these things will be discussed in this particular last video. What are the best exercises during pregnancy? Walking, self prenatal yoga, and same way Kegel exercise for pelvic squats and walls, swimming, and it's all about side lying, leg lifts. Everything is good for the baby. And so, what are the exercises to avoiding pregnancy? It's all about heavy weight lifting, jumping, running, or high impact sports, lying on your back for too long after second trimester. Deep twisting yoga poses must be avoided. To understand the mental awareness when facing childlessness or infertility, acknowledge your feeling, understand your partner's feelings. You need to understand each other. You have to understand your mindset, and same way avoid social pressure and unwanted advices. Seek emotional support, be together, and manage stress and anxiety. Focus on what you can control, strengthen your relationship, hopeful and positive, because no matter what, life has to move on. You have a lot of solution. If you have good mindset, the partner would make you happy. You can even do anything if you have money. So your mindset and partner mindset must be together for sure. Only then this particular situation can be overcome. Now you're gonna see certain important disorders which happens in pregnancy time. Pregnancy can be affected by various disorders which may pose risk to both the mother and the baby. First come hypertensive, that is gestational hypertension, high blood pressure that develops after 20 weeks of pregnancy. And next it's all about preeclampsia, that is high blood pressure with signs of organ damage such as protein in urine. And next is all about eclampsia, that is several form of preeclampsia leading to seizures. And next it's all about HELLP syndrome, a several variant of preeclampsia causing hemolysis, enzyme, and low platelet count. And next it's all about gestational diabetes mellitus, see high blood sugar level during pregnancy, which can increase the risk of complication for mother and baby. And next it's all about infection during pregnancy that includes toxoplasmosis, cytomegalovirus, and herpes simplex virus. And same urinary test infections such as common and can lead to kidney infection if untreated. And same group B streptococcus, that is a bacterial infection that can affect newborns. And same way placental disorders, that is placenta previa, the placenta covers the cervix causing bleeding risk. It's all about preterm labor and birth disorder. Preterm labor before 37 weeks of pregnancy, and the cervix opens too early, increasing miscarriage risk. And same way multiple pregnancy complication, and same way fetal growth disorder. And same way it's all about amniotic fluid disorder. And next it's all about autoimmune and blood disorder, that is Rh incapability, where the mother's Rh negative blood. And the most complicated problem is blood clotting disorder. Blood clotting disorder in pregnancy refers to a condition where the blood clots abnormally increase the risk of complication, for both the mother and baby. So what are the type of blood clotting disorder? First is thrombophilia, that is increased blood clotting tendency. Thrombophilia is a condition where the blood has increased tendency to a rare condition that increase clotting risk. Protein C and protein S deficiency is the cause. So risk in pregnancy such as miscarriage, preeclampsia, intrauterine growth restrictions. And next it's all about antiphospholipid syndrome, major autoimmune disorder where the immune system attacks phospholipid, important for blood flow, leading to clot formation. What are the symptoms of blood clotting disorders? Swelling, redness, or pain in one leg, and say shortness of breath or chest pain, severe headache or vision changes, repeated pregnancy losses, decreased fetal movements. And same way, what are the doctors diagnose clotting disorders using blood sound Doppler studies to check blood flow in placenta. So what are the treatment? Blood thinners and low dose aspirin, frequent monitoring, lifestyle changes, and all these factors would help. Once you got a baby, you need to be prepared. So it's all about baby essentials such as newborn care items such as diapers, wipers, clothing, swaddle blankets, baby bathtubs, diaper bag, feeding essentials. Everything must be ready. Same way, it's all about mother's postpartum care. Physical recovery must be important. Healthy diet must be made. Mental and emotional well-being must be really made. You must have rest and sleep. These health and doctors visits must be made often. Adjustments must be made. You need to make it easy. And same way legal documentation work like birth certificate registration, health insurance for baby, updating workplace on maternity and paternity leave must be. So all this must be made ready. Now the most important, the last part of the video, how many years milk should be given, how a mother must carry a baby. So let's see. Milk is essential part of child's diet, but the type of amount should change as they grow. 0 to 6 months breast milk. Breast milk is the best nutrient for newborns. If breastfeeding is not possible, infant formula is the alternative. No cow's milk. Cow's milk is not recommended before 1 year as it lacks essential nutrients and can be hard to digest. And next 6 months to 1 year, it's all about continue breastfeeding on formula. All about to continue breastfeeding, baby starts solids, but milk remains a primary nutrition. Small amount of yogurt and cheese can be introduced. 1 to 2 years, whole cow's milk. If not breastfeeding, after 1 year, whole milk is recommended because the fat content supports brain development. Continuous breastfeeding if possible. The World Health Organization recommends breastfeeding up to at least 2 years. And same with 2 to 5 years, switch to low fat or skim milk, such as after 2 years, children can switch to lower fat milk unless advised otherwise by doctor. Milk intake should be limited or 2 to 3 cups, that is 16 to 24 ounce, that is 500 to 700 ml per day is sufficient. Excess milk can reduce iron absorption and lead to deficiency. And beyond 5 years, milk is optional but beneficial. After 5 years, milk is not mandatory if the child gets enough calcium and vitamin D from other sources such as cheese, yogurt, leafy greens, fortified foods. That is well. And so the most important, milk should be given at least until 5 years, but breastfeeding can continue up to 2 years or beyond if preferred. After childhood, milk can be included based on dietary needs, but it is not essential if their calcium rich foods are consumed. And the final tips, it's all about offer a variety of textures and flavors, ensure iron rich foods such as dal, eggs, spinach for brain development, continue breastfeeding or milk intake as needed, avoid junk food, surgery drinks and artificial flavors, in order to make the mother and baby. This video would be really useful for the future. And after doing this video, I felt about my mother's pain, how much she would be having those pain during pregnancy. And same with this video is dedicated to my sister, to all my other sisters, to all my friends who are gonna be the mothers of the next generation. You never know the pressure and the amount of energy I'm using to do a video, because the editing part is not easy, because in order to create such an important topic, I need to sit and edit it out just for you. So please do support me. This topic is gonna be the dynamic topic of my YouTube world. So with that thought, in this video, take care, have a great